uh, began to realize that it really was something that resonated very deeply with my own personal values, my social work values, my faith values, just who I wanted to be in the world. And so for me, the journey of learning motivational interviewing as an approach, as a style, has really been helpful to me along the way, in addition to all of the other knowledge and experience and learned wisdom and knowledge that you have, including lived experience. And I want to just acknowledge the fact that all of you on this call probably come from lots of different backgrounds, including people with lived experience, including people providing case management, direct service, people who do middle management, supervision, people in upper management, and everywhere around. So one of the beauties of this approach is that it is applicable to anyone, regardless of your background, regardless of your level of education, regardless of pretty much anything that, you know, other than the fact that if you come to this work as a human being who has compassion in your heart, and you want to be person-centered and trauma-informed, housing-focused, recovery-oriented, peer-integrated, self-compassionate, these are all things that I think motivational interviewing fits into nicely. I also recognize that many of you have already been exposed to some training or some reading in motivational interviewing, and that's terrific. Some of you are probably a bit more of a blank slate. That's also terrific. And obviously today we have an hour and a half together in which I'm going to try to provide a rich overview, but this of course will be something that hopefully will spur you on to further curiosity about this approach and to learn the skills and strengthen the skills that you might already have. So before we get going, I'll just say I welcome your input in the chat box. Lyric, I'll invite you to keep an eye on it with me. Any questions, comments along the way. And so I hope that you'll help co-create this training with me as best as you can. I want to start with an MI meditation that is drawn from a manual that was developed specifically for Indigenous people around using motivational interviewing, called Weaving Native American and Western Practices. And I think it really captures the overall spirit, mindset, heart set of the approach, which is critically important in how we show up with people and how we do the work. And so I'll invite you just to, in your own way of centering yourself, follow along with me as I read it. Guide me to be a patient companion, to listen with a heart as open as the sky. Grant me vision to see through this person's eyes and eager ears to hear their story. Create a safe and open meadow in which we may walk together, and make me a clear pool in which they may reflect. Guide me to find in them your beauty and wisdom, knowing your desire for them to be in harmony, healthy, loving, and strong. Let me honor and respect their choosing of their own path and bless them to walk it freely. And may I know once again that although they and I are different, yet there is a peaceful place where we are one. So I don't know how that sits with you, how that resonates, but what it really does do in my mind is speak to the importance of how we show up, how we prepare to be with people, how we prepare ourselves, how we take care of ourselves, our minds, our bodies, our spirits. It also has to do with our attitudes that we have, our biases, recognition of those, pretty much everything that we bring forward. It's going to show up in our interactions with people that we serve, right? And including colleagues. And so I really you'll see I'll be emphasizing this along the way, because how we show up will then give a good background to the words that we use and the things we say and the things we do. The other thing I'll say about this is that people experiencing homelessness, as well as everybody else, has a desire to be met, a desire to be seen, a desire to be heard, a desire to be taken into account. And this is all, of course, part of being trauma informed, if we want to call it that. But it's the importance of seeing people as people, not as a client necessarily, although we might use that terminology, but seeing people as a whole person. And of course, in the homelessness and housing field, seeing people as a whole person means that we need to pay attention to the whole person, and no one person can do that, of course. And so we each play our role. But I hope that there's a recognition that we're all in this together, in the effort to create the conditions for people to find opportunities to choose that are more healthy, life-giving, peaceful, and so much more. So I have 3 learning objectives I'd like to share with you. One is just this idea of how to conversations about change utilize a guiding approach, much more than a directive one in which we give our best advice and hope people will take it. We're instead going to help people give themselves their own best advice and hope they take it. We want to identify some key questions that are helpful to ask people to elicit and strengthen their motivation to change. And then we're going to talk about the 4 elements of the spirit of MI and more. So I would love if you would put your fingers on your keyboards and just tell me, what are some of the common issues that you do explore with people you serve, just in the day in, day out work that you do? What do you end up addressing, talking about, exploring, figuring out? Just name them, anything that comes up. So trauma certainly comes up, substance use, employment, medical needs, trauma, housing. Yeah, you're covering the gamut here. Health, safety, housing, medical needs, resistance. Yeah. And we might call that ambivalence as well, right? Getting jobs, housing insecurity, food insecurity, perhaps too, healthy boundaries. Yeah, all of these things. And so government services and dealing with systems, right, that are less than user-friendly sometimes. And people lacking motivation, willingness, feeling like they're not sure it's worth the effort, right? And so these are fabulous ones. I tried to anticipate everything you're saying here, and I think we match pretty well with a lot of these things. I think there might also be times that we talk about stigma and discrimination based on racism, gender identity, LGBTQ status. We'll talk with people about isolation, grieving, loneliness, their cultural backgrounds, their own ways of thinking about healing and becoming more at one with their own cultural backgrounds. Immigration status, I'm sure for many of you is a big topic of conversation for people. And so all of these things are things that we day in, day out talk with people about. Now, the question is this, as helping people, of course, we want to be as helpful as we can. And often the way that happens in traditional helping is we hear that somebody has a dilemma, an issue, a concern, a need, and we immediately conjure up in our minds, well, here's a way or 2 or 3 that would be good to address this need. And then we put it out there as an idea, suggestion, a recommendation. And then we, as I said earlier, hope that people will follow up on that. And one of you mentioned in there the notion of resistance, and I'm going to also use the term of ambivalence. It turns out that as helping people, one of the less than helpful things we can do is tell people what we think they ought to do, or even done with the best of intentions. And I think we all know this intuitively, and yet it's hard to get away from that tendency to want to help people in that way. And so we're going to explore this a little bit further today. Now, what do you already know about what it means to have a helpful motivational conversation? And when I say motivational, I don't mean how do we motivate people, because we can't really do that. But what we can do is have conversations that begin to tap into a person's already existing motivations to have a better life, a life of health and wellness, a life of connection, a life of belonging, a life of meaning, a life of participation. What do you already know about what are the ingredients of having a helpful conversation? So focusing on people's strengths, Crystal says, absolutely. Seeing people, maybe not exclusively just their strengths. We're not going to ignore deficits, but we absolutely want to honor and really look at what are the things people are good at, what, not only good at, but what are their qualities that they have. We speak with people and not at them. Yeah, we focus on asking good questions and listening well. Absolutely. Speak less, listen more, for sure. Empathy is at the heart of all of this. Yeah. Curiosity and non-judgmentalness. Beautiful. Yeah. And asking them what motivates them. Absolutely. Tapping into their wisdom. So these are things that you already know, right? The trick for many of us is how to routinely engage with people in a way that we don't sort of try to subtly control or get them to change. And I think you can hear in that language, I need to get that person to do such and such, right? What do you hear in that? Well, I hear coercion. I hear power tripping. I hear this idea that I have power over people. And this, of course, is what is the last thing we want to do, because people who are experiencing homelessness are already have been traumatized in so many different ways, both personally as well as by systems. And so anything we do that piles on, if you will, of taking control, trying to get people to do things, is unlikely to be very helpful. And we're going to get a really strong pushback oftentimes. So I want to share a brief history of MI, and some of you know this. It literally comes out of the substance misuse treatment field. And I'm just going to be very brief here, but William Miller, who's really the principal kind of initiator and author of this approach, found himself about 40, 50 years ago in an alcohol treatment facility, inpatient in Milwaukee, Wisconsin, as a young psychologist who hadn't really been taught much about alcoholism or alcoholism treatment. But he ended up there and wasn't really told, sort of given any particular direction initially. So he did what came naturally to him as he tells the story. And he sat down and he started listening to and talking with people, and listening, like you're all saying here, asking interesting questions, engaging with people, not being judgmental, and not trying to be quote unquote helpful, but just getting to know them, engaging with them. And he heard their stories, right? He heard their stories of how, yes, they had significant problems with, in this case, alcohol and or other substance misuse, but they also had lives, right? They were people with families and friends. They loved to fish and hunt. They loved to root for the Green Bay Packers. They were people who were living with a condition that was really interfering with their life, but that wasn't the entire thing that defined them. And then William Miller, in telling the story, says, I made the mistake, quote unquote, of going and reading the literature about alcoholics and alcoholism. And what do you think he might have read in the 1970s, 1980s about what we believe to be true about alcoholics? What were the kinds of understandings of what was the issue with alcoholics and why they drank and why they didn't change? Anyone know? Yeah, moral failure was a huge part of that. They weren't strong enough in a moral kind of way, right? Or ethical way. They were outcasts. They lacked self-control. Exactly. There was no cure. Yeah, there was no way, very unlikely for people to overcome it. It was a taboo. Yeah, they just needed to relax and not be so anxious. And there was demon alcohol, right? It was like overtaking their lives to the extent that they couldn't control it. There was also in the literature references to people who were considered alcoholics as being pathological liars, because people would say things like, well, I don't have a drinking problem, while they were holding and consuming a large quantity of alcohol, right? Um, the other thing that was believed is that people were in denial about their alcohol use. And the idea around denial was that they couldn't recognize the consequences of their drinking, because as a defense mechanism, it blinded them from seeing what was going on. And so they would say things like, well, it's not that bad, or, yeah, I drink some, but I'm still working and I still get stuff done. And they minimized, if you will. But the idea was that there was a wall of denial getting in the way. And so the treatment of the day, if you want to get rid of a wall, a literal wall, well, we kick it down, we pound it down, we jackhammer it down, we, do whatever we can to get rid of the wall. And then the belief was, once you got rid of the wall of denial, then you'd have a person ripe and ready to begin to see their lives as it is and make changes in their lives. Now, that wall in a treatment setting was kicked down, if you will, not literally, but it was done by heavy confrontation, blaming, yelling, calling out people for their stinking thinking. And it was also utilized a lot of shame and harmful practices, such as making people, if they broke a rule, for instance, or they weren't, acknowledging their moral failings, they would be made to wear an adult diaper outside of their clothing in the milieu, or wear a placard that was kind of like, I'm a failure kind of thing. And the belief of the day, the best practice of the day, was that if you could tear people down, then they could build themselves up. Well, it turns out, as you can imagine, that probably for a few people, it worked, quote unquote, for reasons beyond the treatment. But for most people, they didn't change. They did conform in the moment in order to get out of the spotlight, but they didn't really make a commitment to deep and lasting change. And it was in this context that William Miller said, there's got to be a better way. And this is really where kind of the beginnings of motivational interviewing started. Let me just pause there and see if that rings any bells with any of you, or that sounds familiar from what you've read and seen, maybe even personally experienced in your own life. This very confrontive, shame-based kind of approach. For the heads I am seeing, they're nodding, so I'll go with that. So what was another way? Well, William Miller tapped into the work of Carl Rogers, into medical ethics, the work of a guy named Darrell Bem and self-perception theory. And he developed this theory, if you will, or these ideas around what would be a more humane, helpful way to help people change. And the difference was, rather than seeing people as being in denial, he instead formulated the idea, and it probably wasn't new to him, but that people were ambivalent about change. They felt two ways about change. Just the way you and I are ambivalent about many things in our lives. It's very normal and natural. And sometimes we get stuck in that ambivalence, right? And we sort of spin our wheels. But when we can resolve that ambivalence in one direction or another, that's when then we begin to move in the direction of change, or deciding not to change. All right. So because this is an overview, I'm going to give you an ingredients list for MI, and we're going to go touch on some of them a little bit further. But Um, I'll just say that when we think about the MI approach in general, we're talking about these elements of the spirits, the four guiding processes of a conversation. That is kind of the flow of a helping conversation, whether that's 3 minutes or 5 minutes or 10 minutes or 20 minutes. We talk about the core conversational skills around, like you mentioned already, asking good questions, listening well, affirming strengths, summarizing. And then we also listen for what in MI we call change talk. And that is anything that suggests an interest, a readiness, a willingness, an ability, a need, an urgency to change. We're listening for that because that is typically what is believed to be the primary motivator for people to talk themselves into changing, if you will, and to strengthen their motivation. And we mix these ingredients together and we stir them into a stew or a salad or whatever you choose to make. But there's a simmering process. There's a refining process that needs to take place in which we need to let people, let's say, stew over whatever change it is that they might want to make or are considering making. And it's something that takes time because when one develops a pattern of behavior around substance use or an attitude or bias or stigma or anything, it takes time to sort of reverse that, if you will. So again, to get a little bit more detailed, in the elements of spirit, we will talk about partnering with people, being a person there with shared expertise with that person, of acceptance, of compassion, of evocation, this calling forth. We also talk about the processes in which we typically engage with somebody in a conversation, and then we find some kind of a focus, like we talked about on that little chalkboard earlier, something that we want to talk further about, explore further. And then the evoking process is the listening and the asking that comes around that particular area of focus to help explore it. And then often we move into a planning process in which we maybe develop some next steps of action. Some of this is familiar to all you sometime, and for some of you it's not, but I don't think it's anything particularly new so much as it's makes logical sense, I believe, right? And again, we use these core skills, which do require practice to do them well. And that's why I'm going to be encouraging you after this and in an ongoing way to, if you are curious about learning more, to engage in further learning and practice around this approach. And then we talk about change talk as a desire, an ability, reasons, a need, and then commitment, activation, taking steps. These are terms that we use to sort of tease out the type of change talk it is and how strong it is. All right, well, I thought to demonstrate all this, I wanted to show you two videos. One of these is a video in which we have a dentist who is meeting with a patient named David. And let's just say that her dental practice in this case is less than optimal in terms of using a person-centered, curious approach. And what I'm going to invite you to do is watch the video. It's about 3 minutes or so. And in the chat box or on your own, sort of note what you're noticing in terms of what it is that she's sort of the approach she's using. And the impact it's having on the patient, on David, okay? And then what we're going to do is we're going to watch a second video in which she will have magically learned a lot of skills in a short amount of time, and will demonstrate for us a better illustration. But I think it's helpful to watch these contrasting videos, and you may well see yourself, as I do oftentimes, in this first video, doing our best to provide patient education, if you will, or guidance. And yet at the same time, it might be that there's a better way. So let's just take a listen, and feel free to comment in the chat box as we go. And then we'll talk briefly about the first one. Here goes.
Okay, so why don't you have a rinse, David? How are you feeling?
Okay.
Good. Here, take a look. See what you think. That feeling, and the color's okay? You know, there is quite a lot of staining, so I'm just wondering about some concerns about smoking, possibly
Gonna get that again.
coffee, tea. Yeah, you've heard this
I do
before, I'm
all
sure.
the above, yeah.
So, you know, the smoking is going to be related not just to some of the other negative consequences, you know, physically. It affects dental caries, dental cavities, healing in your mouth.
Okay, sure.
So,
I've heard it all. But I just want to get my teeth fixed.
yes, and I really want to be helpful. I really want to, you know, my commitment is to your oral health. So there are lots of medications out there, David, that actually take away a lot of the cravings. They make quitting so much easier.
I did a pill thing, so I did try it. So, I did try it. I just did the pills and they didn't work. It was a waste and it caused more side effects.
No, but David, it's not a waste. Research shows that people take on average about 7 tries before they quit smoking. So think of it as you're one step closer to quitting.
Or 7 lectures along the road.
Well, I don't think I'm giving you a lecture. That's certainly not what I meant.
No, I just feel that way. I get very defensive about it when they bring, because I get it from my family doc, my cardiologist, everybody. I'm not a complete fool. I am for smoking.
Well, there's a reason that people are concerned.
Not easy to quit.
No, but as I said, these medications, so you've tried the medication, you've been willing once, then can I write you a prescription for the medication? Can we talk about how you could use it? Because this is something that's very important, not just for your overall physical health.
I guess I got to really want to. And things I've tried usually cause me more problems than they helped.
Oh no, the smoking's going to cause you more problems than anything else. I can promise you that, David. Okay. The side effects from the medications are nothing compared to what can happen from the smoking. Like that's the, I think, thing to really consider.
Okay, well, can I go now?
I'm okay, but you know,
I know, Doc, what you're trying to do, but I just don't want to get into that right now.
Okay, well, thanks for listening. And honestly, I am really worried about the smoking. So
okay, I appreciate your caring.
I'm here to help. Okay.
Okay.
All right. Well.
Okay, so why don't you have a rinse, David?
So I'm looking at your comments here. Fabulous. Yeah. So I'm seeing sort of the 7 lectures along the road is super relatable. Yeah. And she's assuming he hasn't tried to stop, right? Or that he's not tried the right thing to start, maybe. And Danica says this is painfully pushy. Yeah. And we've probably all been on the receiving end of this in some place, somewhere, somehow, maybe at the dentist office, but maybe elsewhere. And Erin says there's a lot of shaming, a lot of pushing, a lot of trying to get him to do something, right? It's interesting. The one question she asked him has nothing to do with exploring his thoughts or feelings. It's, can I write you a prescription, right? And so she's on a roll. She's got a script and she's following it, and she's assuming that he doesn't care about his health, as Mesha says, and she's not meeting him where he's at. Obviously, he says, "I just want to get my teeth fixed," and she's got her timing all off, and her approach is all off as well, right? So guilt tripping, never a path. Absolutely, he's heard it all. So she didn't really offer anything new. Now, what are her hopes for him? Well, I can answer that for you, I think. She hopes that he'll attend to his oral health because she does care about his oral health. So she's well-intended. That's not the issue at hand. What are her methods? Well, you've already begun to describe some of them. A lot of guilt tripping, a lot of so-called patient education or teaching, telling him things from her expertise, much of which he already knows. And Mesha, I like your comment too. She's assuming that pills are the likely solution to the problem. And absolutely, they're not always, or Sometimes they can be supplemental, but they're rarely the only solution to any problem. But again, in a medical model, in a dental model, this is kind of the approach that is taken. Now, I want to ask you, what is the outcome? And if you would put in the chat box, or somebody can come off mute if you want, but let's say you're David, you're sitting there, you end the conversation and you say, "Can I go now?" Which says a lot, right? He walks out. What's he thinking? What's he going to do? What's he going to do, not just in the moment, but over the next little while, in terms of how he kind of processes that visit that he just had with this dentist? What's going through his mind? He's definitely going to smoke, Heidi. Yes. I think he's going to light up 2 or 3 cigarettes at a time, probably. He's very frustrated. Yeah. Likely not go back to her anytime soon or at all. Yep. I don't want to go back and be berated again, right? Like that. He's going to avoid seeking care, maybe avoid his teeth, dental care in general, and feeling defeated, not trusting, thinking, "You can't tell me what to do." Absolutely, Julie. I think that is at the central part of this. You can't tell me what to do. And it turns out, as many of you know, that the more we tell people what we think they ought to do, let's use the example of somebody, and they've done studies around this, somebody who's got a serious alcohol problem, and the person's physician, loved ones, friends are all saying, "You've got to stop, you can't keep going like this." What's that person likely to do? Well, they're likely to continue drinking, and not only that, but actually increase their use of alcohol, because I think it's this notion of, "You can't tell me what to do, I'll show you," right? And so, so much to unpack here. Linda, I totally agree with you. When he says, "Can I go now?" He does sound like a little kid. It was like she was parenting, being a not so helpful parent in this interchange. And so the shame spiral, Crystal, you're absolutely right, is going on. The thing he's not thinking about, which is unfortunate, is he's unlikely to be thinking about why he might want to quit smoking, how he might consider quit smoking, why it would be good for his health. He's not thinking about any of those things, because in the context of the conversation, what was created was a conflictual kind of conversation in which he's thinking about the interchange, not the information or the topic at hand. And yes, the snowball effect, the potential to dig his heels in, and that's likely what he's to continue thinking about. All right, I'm going to propose that we have a lot of grace in our hearts, and we give the dentist an opportunity to redeem herself. Let's say she is a really fast learner, and while we've been talking, she took a quick course in MI, but she's got a different approach now. So again, I'm going to invite you, as we watch this video, to comment what you see going on in terms of her style, her approach, and see what is different this time. And then we're also going to look at what the impact is on David, likely. Here we go.
Okay, David, so why don't you take a rinse, and how are you feeling?
Pretty good.
Would you like to check this out? What do you think?
Oh, that one's fixed really nice.
Yeah.
You got rid of that bad discoloration that was there.
Yeah. No,
I like
think
that.
It went well. Good. Excellent. I did notice quite a lot of staining, actually. I'm wondering, what are your thoughts about what might be related to that?
Well, the usual suspects: smoking, wine, coffee,
Yeah.
all of the above.
Any thoughts on considering quitting smoking at this time?
Yeah, I thought about it. It's not my cup of tea. I hear it from everybody, and I've tried before. It didn't work. I get it all the time.
Okay. And it's like, here I am, one more person, the next doctor who's saying, you need to quit smoking, David. And I'm sorry, that's not how I mean to come across it.
I know I'm not an idiot, and people know that smokers are, how can you smoke today? it's just not that easy to quit.
And if it was as easy as a doctor saying, or your partner saying,
Who wouldn't be?
You have to
You'd have to
quit.
be a real fool not to do it if
Yeah.
you was going to make it like that.
yeah,
I just hear it every day.
yeah. And what's been your past experience with smoking? Can you tell me a little bit about kind of how the role it plays in your life, how long you've smoked?
Yeah, I've smoked for 40 years, since I was 14. And quit a couple of times, off and on in the 20s, but it's been consistent. And I can't see myself changing now, no matter what kind of talk I get or what they come up with.
It sounds like almost you've tried a lot of things that are out there, and it's not something
Not
that
going to
you're...
work for me.
Yeah, yeah,
No.
yeah.
I know cold turkey is probably the only thing that's ever going to do it. Anybody that's done it, in my group, it's been cold turkey, and then they fight it. But it's my choice, and I don't like lectures about it.
Yeah, and it really is your choice. You're absolutely right that nobody has the right to tell you what to do. Can I ask, if there was to be a situation where you decided I must quit, what would that situation be?
Hard to tell, because I've already had open heart surgery. That didn't do it. Prostate cancer, that didn't do it.
Right.
I don't know. I really don't know. I just don't really want it.
So this is something that you
Have to-
pretty much see yourself doing for...
Yeah, quite a while yet.
Yeah. Okay. Well, I really appreciate you being willing to even talk about it. And I get that right now this is not something that you want to pursue. Would it be okay if I brought it up in our next visit? Because I know that you've said you don't want to lecture, but on the other hand, I am concerned.
Okay, yeah, I could go for that. I'm always open to, to listen.
As long as I don't talk too
Yeah.
much. Okay.
There could be options. I had my surgeon just go like, why do I even keep you as a patient? He's good though.
You were glad to keep him
Yeah.
as a doctor.
Yeah.
Yeah. Well, and David, honestly, wherever you're at, we'll work with it.
Okay.
And so thanks for taking a couple minutes and talking about smoking.
Thanks, Doc.
Okay, thanks.
Oh, Ken, you're on mute.
Thank you. I'll start over. Yeah, thanks for all your comments here. Loving that you're noticing that he's doing more talking than she is. That would be a good characteristic of a helping conversation. She's repeating what he's saying. She's providing what we call reflective statements back to him to let him know that she's hearing, that she's seeking to understand, and she's noticing the things that he is maybe hoping for as well, right? A lot more listening, asking about his personal experience. So she asked some really key questions, doesn't she? And I just want to go over a few of these. She says things like, right off the bat, she says, I noticed a lot of staining, but instead of saying what she thinks it's about, she says, what are your thoughts about that? And so he then begins to articulate what it is that it might be related to, the usual suspects, he says. And then she cuts to the chase and she says, I'm curious, any thoughts on quitting smoking at this time? But she says it in a tone that's not expectant that he will, or berating or shaming. It's just curious. Any thoughts on quitting? No, not for me. It's not my cup of tea, he says, right? And then she kind of apologizes in some ways and says, well, yeah. And he says, no, it's not going to work for me. And she says, yeah, and here I am, one more person. So she gets the fact that he's probably used to being told not to, or to quit smoking. And she acknowledges it's not as easy as it might look, right? And then she asks another key question. And she says, and it's kind of a looking back question. She says, what has been your past experience with smoking? Well, he says, I've been doing it for 40 years and I've tried several times, including cold turkey, but I can't see myself changing now. And she says, yeah, you've tried a lot of things out there. And then he says, it's in the long run, it's my choice. I don't like lectures, which is exactly the antidote to um, the question of that one of you mentioned earlier is, you can't tell me what to do. And her response to him is, you are absolutely right. Nobody else can tell you what you need to do, right? So affirming the fact that autonomy is his, the choice is ultimately his, is really powerful and important here, right? And then she asks a future-oriented question, and she says, I'm curious, if there was to be a time when you would quit smoking, what would that situation be? What would that circumstance be? And so she's asking him to imagine in the future, when and if the time ever comes, what might be the tipping point, right? And of course, he says, well, prostate cancer, open heart surgery, none of that made a difference. He says, I really don't want it. Now, she could have stopped there and said, well, okay, or out of frustration, maybe. Or she could have said, all right, well, we'll drop it. And whenever you're ready, come back and let me know. But instead, what she does is she says, yeah, you pretty much see yourself continuing to smoke for a while. She says, I do wonder, would it be all right if I brought it up at the next visit, that we could maybe talk about this a little bit further, because I am concerned, which is a beautiful statement to make, right? And then at the very end, he agrees to that. At the very end, she makes a comment that I think is so powerful. She says, wherever you're at, we'll work with it. Thank you for talking with me about smoking. That's a really beautiful exchange that really captures the spirit and the style of the motivational conversation approach. And, it's not a formula. It's something that kind of flows out of her, but she has an idea of the kinds of key questions she wants to ask and how she wants to address them. So what is the outcome with David, would you say? What's different now? David gets up, walks out. I'm guaranteeing you that he smokes. I think we all agree he lights up a cigarette, okay? But what else is going on now? What's he thinking? What's he feeling? We're making this up, of course, but what do you imagine David is pondering, wondering about, thinking? What do you think? He'll probably come back. Yep. He might feel like he has a supportive resource in her. He's been feeling heard. He's feeling validated. Yep. He's more open, and maybe more open to even thinking about smoking and what role it plays in his life. He's actually thinking about his past experience. He might be saying, my God, I've been doing this for 40 years. What impact is that having? Because he knows about the impact of smoking, right? He knows that he also isn't ready yet. And at the same time, he said it would be okay to talk about it next time. And I would guess that as he walks away from that conversation, he might also begin asking himself in his own head, why is it that prostate cancer, why is it that open heart surgery didn't tip the scale? And what do I want in life? And how is this impacting me? And he'll notice that cough that that smoker's cough, right, that we all heard. He'll look at those cigarettes he's smoking and you say, wow, why are they so important to me? And again, we're making it up, but he's now going to be, I think, a lot more curious about his smoking and much less defended about his smoking. And that's the key to a good motivational conversation. When people walk away feeling more curious, and when they say things like, maybe I should think about that a little bit more. What I want to say about MI conversations is they do not stop after 3 or 4 minutes of your talking with them. And if you've had the conversation like the dentist had in the second one with somebody, regardless of the topic, if they walk away and they begin thinking a little bit differently or imagining a little bit differently about their future and what changes they might want to make, whether that's getting housing, whether that's looking for a job, whether it's getting an education, whether it's applying for entitlements, whether it's going to see a doctor, taking medications, or any number of things that people are ambivalent about. He's now going to carry on that conversation in his own mind and might, in fact, end up talking himself into a change that we don't get to witness, or the dentist doesn't get to witness in the moment. And I'm saying all of that because if we create the conditions for a conversation to happen where a person walks away a little bit more curious about their situation, including with a little bit more information that we may have provided as well, they are likely to continue the conversation on outside of our presence. And that's the important and beautiful part of all this. Any other thoughts before we move ahead? I do want to say that I realize that you are all not dentists, I'm assuming, but we all are dentist-like, if you will, in that we are working with people around behaviors, around issues about which they feel ambivalent. And it doesn't really matter what the topic is, the approach is still going to be similar from the standpoint of listening well, asking interesting questions, and then inviting people to think a little differently about their situation. So what are we talking about? Here's a brief video of William Miller, fairly recent video, talking about motivational interviewing.
What is motivational interviewing? I mean, it's a way of having a conversation about change. And it's a particular way about having a conversation about change that listens to and calls forth the person's own ideas about whether to do that and why to do it.
Oh, Ken, you're on mute. Sorry.
I'm so sorry. You would think I would learn after so many years, but yeah, just to reiterate, it's a conversation about change. That's what motivational interviewing is, or motivational conversations. But it's a particular conversation about change, and it's centered on calling forth the person's own ideas about how, why, when, where to make a change. And that's the difference between the style that so often we see in typical helping situations where people tell you, teach you, provide options, do all of those things. And I'm not saying all that's wrong, except that we're much better off tapping into what people's own motivations, what their own thoughts and feelings are. And then we also do at times say things like, would it be all right if I share an idea, a resource, or a thought that I'm having, or a concern I'm having? But we do that in a very gentle way without imposing it, but inviting people to consider it. So I want to offer you a personal taste of MI, and it's not going to be exactly an MI conversation, but it's one in which I'm going to invite you to talk about something with yourself. You're not going to share it with anyone else. And I'm going to invite you by offering a few key questions to consider your own level of motivation and desire to change. And so you don't have to do this, of course, you're not compelled to, but I hope you will. And I'd love if you could think of a dilemma. Maybe it's an attitude, a behavior, a concern, something that you have in your life that you've been thinking about changing, maybe even have tried to change, but it hasn't really taken hold. And again, I'm not going to invite you to share this in any way, not in the chat box or anywhere else, just on your own. And what I'm going to do is I'm going to invite you to think about a few key questions. But before I do that, if there are any of you who just simply can't think of anything about yourself that you think you need to change, you know who you are. This slide is for you. A lot of fine print here, but I put this up here just to share that there are so many things we can talk with people about change. Obviously, you know, sex, drugs, rock and roll, those kinds of things. But it's all the sort of things that happen in the homelessness housing world, of course, around, you know, talking with the landlord, or how to intervene with other people and ensure your rent gets paid on time, and how to develop ways to be in the world, to make a housing into a home, and all of these things. But the idea here is that pretty much anything that people have mixed feelings about is ripe for a conversation about change. All right. I trust that you have something in mind from this list or from your own head that is something that's maybe not a deep, dark secret, but also not something too superficial, that's a real thing to you. All right. And so I'm just going to ask a few questions and invite you to ponder your responses, either just in your mind, or maybe by jotting down a few ideas. The very first question is, I'd like you to consider why you might want to make this change. Or you could even say what could be possible benefits of making this change. And so take a moment, if you will, just to think about that. Another question might be, what could be at stake if you don't change? In other words, what might be some possible consequences that you'd prefer not to have happen? Another question, how might you go about changing if you chose to, in order to be successful? There are many pathways to change, many pathways to recovery, many pathways to Rome, many pathways. What do you think might work well for you? What would be your 3 best reasons to change? This is asking about importance and prioritization. What would be the ones that rise to the top, that would probably be tied to some of the deeply held values you have? So who could support you? It's really hard for most of us to make a change on our own. And it's much better to have somebody who has our back, who's there to nudge us, to support us, to be there with us. So who might that be in your life? It might be one or more people. The last question I'll invite you to consider is, if you were at some point ready to make a next step or two, what might those be? What do you imagine, when you're ready to take action, you might do as a very next 1 or 2 steps that are very simple, measurable, easy to do, to help you move in the direction of the change that you're considering at this point? All right. So there are other questions, of course, that could be asked. But one of the reasons for asking some of these particular questions is that they actually kind of match up with what we call in motivational interviewing the darn cat change talk. And linguists have looked at people's conversations when they're talking about making a change of some sort, and they've kind of recognized different categories. The first is this larger category of preparatory change talk, meaning sort of getting ready, thinking about, preparing for change, in which people might give our voice to why they would like to change, how they'd like things to be different, how they wish things could be. They might talk about what they could do, they think, that would work for them. Maybe that's an affordability issue. Maybe it's where you are. It might be related to your cultural background and practices. Reasons why you might want to change? What would be your 3 best reasons to make a change? How might you go about it? And your need to change. This is about urgency. Everybody has lots of things going on, right? Well, how does this rise? To what extent does this rise to a level of needing to take action to move in this direction? And then we move into what might be called mobilizing or activating change talk, in which we find ourselves starting to say, I'm going to try that. I'm going to do something. I'm going to go out and put air in my tires and my bike and do a little more biking. I'm going to go, find a place where I can do walking and jogging, maybe, and taking steps, making an appointment. These are all things that begin to move us even closer to action and taking action. So let me just go back for a moment and just ask, if you wouldn't mind, which of these questions kind of drew your attention most? I'm not asking you to tell me about the content, but just, I'm kind of curious which of these kind of grabbed your attention, just so we can kind of see what other people, their own experience. Because I found that different questions resonate differently with people. Who could best support you? Yeah, Angela, that was the one that grabbed your attention. The 3 best reasons. Who could support you? Why might you want to make this change? What might be some benefits? What might be at stake? Yeah, absolutely. And so, as you can see, there are lots of different ways that these questions land. And so that's why in the course of a conversation, it's worth considering asking, 1, 2, or 3 of these questions, just to get at different facets of this thing that we call motivation. All right, thank you for engaging in that. And if it seemed helpful in some way and spurs you to think further about change, great. If not, so be it. That's fine too. The common responses that people have to like that second dental interview, and hopefully to the one I just had with you, in which I asked these key questions. Of course, I didn't have a chance to reflect back and go deeper, but generally people find themselves feeling these ways when somebody approaches them with a sense of compassionate curiosity, is what I like to call it, and doesn't try to bowl them over, doesn't try to get them to do something. It simply asks interesting questions, shows concern, interest, and often people feel met, feel heard, feel like they're taken into account. You believe them, that you believe in them. And these are all such critical factors for people to entertain the possibility of change. Another video that really, I think, speaks even a little bit further about this notion of MI, and it speaks specifically about a guiding kind of conversation as opposed to a directing conversation or a following conversation. And so let's listen to William Miller in this one for a moment.
Fundamentally, motivational interviewing involves a change in role, a change in how you think about what you're doing. You're not the expert there to fix the person. You don't have to make the person change. The truth is, in fact, that you can't make a person change. You don't have to be the one to come up with all the good ideas. A person with really good ideas is sitting across from you and may have better ideas than you do. It's not like a competitive sport. It's not like wrestling where you try to defeat and pin and outsmart and outwit the person. It's more like dancing together, moving together, adjusting your movements to the other person. Overall, motivational interviewing is not a directive approach. Neither is it just a following approach. Following is listening to the person and kind of going wherever they go. Motivational interviewing is in the middle, between those two, and we describe it as guiding. If you go to another country and you hire a guide, you don't expect the guide just to follow you around. That's not what you're looking for. Neither do you expect the guide to order you when you will arrive, when you will leave, what you want to see, what you will enjoy, what you're going to do, that's not a good guide either. Good guiding involves good listening as well as using your own expertise. A good guide will find out where you want to go, what you're interested in, what you're hoping for on this journey, and then help you get there using his or her own expertise, enjoyably, safely, efficiently perhaps. That's the guide's job. Not solely directing, not solely following. There's some of each in it, but it's a blend of those things. This may or may not be the way you've been thinking about your own work, but we invite you to try it out.
Just curious if anything jumps out at you, resonates with you that you might want to comment on in the chat box, or come off mute and just say a word or two. That would be fine too. I will say personally, I find this metaphor, this notion of being a guide, really helpful. And it can keep us in a healthy place as helping people so that we don't get too passive. Although there's a time when we do want to just follow, and that might be when somebody's grieving or needing to just pour out their story or whatever. Yeah, then we just follow and listen. We're not having a conversation about change then. But we also don't want to get on the opposite side of trying to sort of dictate and control where people are going and how they're going there and when. I wouldn't like that kind of a guide, and I don't think most of us would. There might be times when that directive role might make sense, usually in a crisis perhaps of some sort or an emergency, but generally speaking, we want somebody to walk alongside us in solidarity with us. And so I just want to say a little bit more about the spirit of MI. It's so critical. And the authors talk about when they first began teaching this approach in the 1980s, that they found that they were focusing on technique, but they were missing something. And they said, as we watched people practicing this approach, it almost seemed like we had taught them the words, but not the music. And this is when we started working and talking about the mindset and heart set. So there are 4 elements we think about here. And I'll just say personally, these are like guidelines for me, for my life in general, not just for clinical practice or case management, or these are, I think, really foundational ways of being in the world that I personally choose and try to emulate. And I imagine for many of you, this will be the case too. So very briefly, let's just take a look. First of all, we're talking about partnering with people. Yes, there's always going to be a power differential, but the more we can recognize that whenever we meet up with somebody, this is a collaboration. They have expertise, they have knowledge and wisdom that we can't pretend to have. We have expertise, we have knowledge that they don't have, but we want to mutually share that back and forth with a profound and fundamental respect for one another in the process. And so we use the metaphor of dancing rather than wrestling. And of course, if you dance with me, I'll step on your toes likely. So we do step on people's toes sometimes, but in that dance, we apologize and keep moving. When it comes to wrestling, and I'm imagining most of us have been in wrestling matches, not physically, but otherwise with people we serve. It just doesn't work. Doesn't feel good for anybody, and it doesn't promote change. And so we work in a fundamental partnership with people, being respectful of who they are, what they have, and what they bring to the table. We also prize people's inherent worth and potential, which is one aspect of acceptance, right? And I share with you here an image of Edwin Gibbons, a man who lived on Skid Row in Los Angeles for many, many years. And he was offered housing through a housing first approach. And Edwin took that housing, and nobody said he had to make any changes. He didn't have to go get medical care, get psychiatric care, didn't have to change his drinking. He was just told that you can have this place and we will be here and available to you to have conversation and support you. And over the course of time, Edwin decided, for reasons maybe we don't even fully understand, that he wanted to make a change. And he asked staff, could you help me get into detox? And of course they said yes, and they helped him get into detox. And then I don't know the full story, but he entered into a recovery process. And so somebody somewhere along the line believed not only in his inherent worth, but his inherent potential. And then he began to believe it in his inherent potential. And so today he's become a spokesperson for somebody, for Housing First, and for the fact that change can happen, and he's supporting others in change. I'm guessing that you have images somewhat like this in your imagination or your reality of people who have made pretty dramatic changes and have entered into recovery. Maybe you yourself are one of these individuals. Maybe it hasn't been quite so dramatic as you see here. Maybe it was. But the point being is that if we believe in people and believe that they can change, they're more likely to adopt that belief for themselves. Conversely, if we basically say to ourselves, there's no chance that I see this person going anywhere, they will pick up that attitude. They will pick up and probably just feel more self-defeated than ever. So we talk about inherent worth and potential. We talk about providing accurate empathy. Accurate empathy is that which makes a good guess about what people are feeling, thinking, wondering, hoping for. And we often offer that through a reflective statement, through reflective listening, active listening. Supporting autonomy, something we've already touched on, is a huge part of acceptance. Honoring the fact that people can and will and do make choices for themselves. And sometimes we think that we can control people or get them to do things, but that's actually kind of delusional on our part when it comes down to it. And then affirming strengths. Again, these things have been mentioned before, but it's so critical for us to see people for all the good things about them and through that lens, as well as acknowledging what's not going so well. But if we just focus in on trying to fix the deficits, that is not a likely recipe for success in change, because people need to be able to see themselves and have others see them for their own beauty and brilliance and knowledge and wisdom and cultural understandings and their humor and their whatever those things are in people. And it's different for different people. But if we can't see people through a lens where we look up to them and we see them for out of utmost respect, but also an admiration even, we are unlikely to be as successful in our interactions with people. So we have partnership, acceptance. We also have compassion. And I think of this as what I'm sure all of you do day in, day out. You come alongside people in their difficulty, in their homelessness, in their addiction, in their difficulties with parenting, whatever those things are, in their suffering. And in the context of that, we actively promote their welfare, their needs. I would also say that in the context of that, in coming alongside people in solidarity with them, we are also being there to simply acknowledge the suffering they're experiencing without trying to fix it. So often we as helping people are tempted to say things like, yeah, this will get better, or don't worry, time heals all wounds, or we say all these things that are hopeful statements that are intended to encourage people. But in truth, people hear them oftentimes as superficial and not sincere, when in fact, it might be much more helpful to say something along the lines of, I'm so sorry for all you're having to go through. It must be hard. When we start with this kind of deep compassion for people, where we ourselves even suffer a bit in being in solidarity with them, there's something about that that creates a connection between human beings that is compelling and often motivating for them to begin to look beyond their suffering. And we need to do this with a compassionate detachment. So I don't know if you're familiar with this concept, but it's a detachment, not in a negative way, but it's being able to step back far enough and respecting that our guests' power is their own, and we don't have to rescue them. We don't have to jump in and do things for them that they can do for themselves. Now, that's not to say sometimes we don't pick up the phone and make the call on someone's behalf, or we don't do certain things, but it's this not getting overly involved in an enmeshed way. And at the same time, having a sense of compassionate detachment where we respect ourselves enough to not take people's difficulties on as our own and let it harm us. Absolutely, there is secondary traumatic stress in this work, vicarious traumatization. It's going to happen, but it doesn't have to harm us. It can be something that can be mitigated against. So I don't know how that sits with you, but I know that people who get into helping professions sometimes do so because of this incredibly compelling need to be helpful to other people. And that only goes so far. There's a saying that people who want to help in the worst possible way often do. And so I think we all know that there's a certain boundariness that's required in our helping relationships, where we connect with people, but we don't overwhelm them or ourselves with our relationship part. And this is all part of motivational conversations. This is a favorite quote of mine from the book Tattoos on the Heart by Gregory Boyle, who works with street gangs in South Los Angeles. What we seek is a compassion that can stand in awe at what people have to carry, rather than standing in judgment about how they carry it. The fact is that people come to us seeking services in all manner of different ways. And sometimes they do it in a way that feels very user-friendly and mutual. But many times we also have people come to us out of a sense of, it feels like they're demanding or entitled, or these terms that we use, right? They're yelling in our face. They're saying things like, you don't care about me. And all of these kinds of things that are really off-putting for us. But we need to recognize that this is often coming from trauma. This is coming from a place of not being able to trust, not being able to enter into a more of a mutual relationship, and instead keeps things at a transactional kind of relationship. And so these are the things that we as people who are in helping roles need to recognize, that this is coming from somewhere else. It's sometimes, but rarely, hopefully, directed to us generally about what we did. All right. So the last of these four elements of the spirit is what we'll call evocation, literally meaning to call forth from. A vocation is a calling, right? And when you call forth from someone their own knowledge, their own understanding, their own hopes, their own wisdom, this is the heart and soul of this approach. Now, this is premised on the fact that we need to believe, I think, that people do, in fact, desire to live a life of wholeness, of happiness, of connection, of wellness, of being in meaningful connection with other people and work and opportunities, of having a life that they give back even. All of these things, I believe, people possess within themselves, and it's for us to tap into that rather than think that we can sort of give them a drip line that puts it into them. What if we encountered everybody we saw, and in the back of our mind we said to that person or about that person, you already have what you need. Together we will find it. That's a very, very different helping stance than what traditional helping looks like. And there is a space for traditional helping, like in acute care medicine for sure. But when it comes to people making decisions about their lives, it's not for us to tell them what they need and how they ought to find it. It's for them to do that, but through our careful listening and guiding questions. So there you have the spirit of MI in an acronym, if you choose to want to remember it that way. All right. Doing a time check here. In the time remaining, I just wanted to say the beauty of this approach is you don't have to be all that bright, complex, clever, educated. Just be human and be interested in people and be curious about what makes them tick and believe in them that they can, in fact, tap into their own inner wisdom. And so we need to come in with an uncluttered mind, right? And that clutter sometimes, I'd love to have more time and ask you, but that clutter is often our thinking that we know what's best for people, or our insistence on one way being the right way, or that clutter sometimes is being distracted, or many things. But if we come and try to be fully present to people and listen well to them, ask them interesting questions, affirm their strengths, this can make a huge difference in people's lives. And I'm not saying it's easy. It is challenging, but I will say it's ultimately much more satisfying and life-giving than being there to think that you have the answers and need to tell people what they need to do. In the long run, MI is about looking ultimately to helping a person face their future. And so, yes, we ask about the present, we ask about the past, but much like the dentist asked David, if you were to come to a point where you decided you must quit smoking, what would be that situation? That's a future-focused question, asking him to imagine. And there are lots of other ways to ask those questions. If you were to decide to get housing, because we know that moving into housing is not an easy prospect. It's complicated. People are ambivalent about it, especially when they've been out there on the streets for a while. And so we might, in moving into housing, what might be some concerns you have about that? We also might ask, what are you hopeful for about that? What could that give you an opportunity to do that you can't do now? You might even ask, when and if you're able to find that housing and you move into it, how can you make it into a space that feels like it's home, right? How can you find a home in the larger community? These are all things that are future-oriented questions that we might ask. All right, so we're talking a collaborative conversation style for strengthening a person's own motivation and commitment to change. That's one definition. Another is a person-centered style for addressing the common problem of ambivalence that I mentioned. And just to highlight ambivalence, it's this thing that we all experience all the time. You're probably ambivalent right now about something, maybe even about being in this webcast. But it's this simultaneous existence of contradictory feelings and attitudes. And this is perfectly normal, but we also recognize that we can get stuck in it. You've maybe seen this Nike symbol, although this one's a little distorted because this is what this means. When you kind of want to just do it, but not really. That's the essence of ambivalence, basically. And ambivalence is everywhere. It's in song lyrics, it's everywhere you go. My sweet tooth says I wanna, my wisdom tooth says no, Fletcher Henderson, right? I feel so miserable without you, it's almost like you're here. Don't try that at home, but that's ambivalence, right? Or this one from Gillian Welsh, I wanna do right, but not right now, right? These are all kinds of statements that we hear, including when you and I go to a dessert table and we're trying to watch our diet and we say, oh, I really shouldn't, right? But then the next line is either, but I'm going to anyway, or I'm not going to partake, right? So these mixed feelings are there. The question is, what do we do with them and how do we resolve them? I'm gonna show you a brief video here because I think it's so central to motivational conversations about what happens when we use what we call the writing reflex, that is trying to get people to do things, and when that bumps up against ambivalence, what happens? And so the very first part of this video is a little bit choppy for a few seconds, but then it will smooth out. So let's take a listen.
Well, Steve Rolnick and I have written about the writing reflex, which I think comes with being a helper. It comes with wanting to make a positive difference in people's lives. And when you see someone going down the wrong road, somewhere that's going to lead them to painful outcomes, you want to run around and get in front of them and say, stop, go back, don't you see? I mean, go this way instead. And it's just a natural outcome of that desire that draws us into helping, which is fine. But the problem is what happens when you do that with an ambivalent person. When you take responsibility for the change, when you say, this is a problem and here's what you need to do, you elicit from the client exactly the other side of the ambivalence, because they have both sides inside of them. And so they're then likely to say, well, it's not that bad, or I'm not sure I need to do that. And you wind up kind of acting out their ambivalence between the two of you, with you taking the good lines and you're leaving the more resistant or reluctant lines to the client. And that's not good, because we hear ourselves talk. And as I hear myself talk, I get committed to what I'm saying. So ironically, if you follow your helper instinct and try to advocate for and persuade and coax and cajole and coerce and confront people into changing, you can actually have the paradoxical effect of eliciting from them lots of resistance, which makes it less likely they're going to change. And so I think that those behaviors come out of the best of intentions and come from a heart of wanting to help. But we have to learn to suppress these. And after 20 years of practice, 25 years of practice of motivational interviewing, I still have to suppress my writing reflex and my desire to take up the good side of the argument, now because I know that's not the best thing to do, and instead to let the client make those arguments.
All right. Well, I don't know how that lands with you, but I think what this suggests to me is that this approach requires a little humility, right? We're not showing off everything we know about resources and what people ought to do in our best judgment. We're really being humble and listening for people to show off themselves what it is that they're thinking about. And then absolutely there is a place in MI to share some additional things. Like we might say, based on what you were saying, would it be all right if I share another thought that I'm having, that you can do with it what you want, but you might fit it into the mix. And again, it's this very highly respectful and I think approach that really empowers people when we treat them in that way. All right. Well, I realize we're getting close to time. I'm actually going to go stop share for a moment, and I'm going to find another video example that I want to finish up with, and then we'll have to call it a day. So I might end up going a few moments over time. And if you have to leave, so be it. But I hope you might be able to stay on for a little bit more. I want to show you a video. It's called The Hustler. And what I like about it, a number of things I like about it. One is that it is kind of specific to homelessness and housing. It's also something that shows that MI can look very different depending on who the person is delivering it. That is to say that many of you who have looked at MI videos have probably seen a lot of white people practicing in sort of settings that are very Eurocentric. And I'm not suggesting it's not good MI, but MI always looks like you and whoever you are, your own personality and your own style, and needs to be adapted to it rather than each of us adapting to some person that we've seen. So we have here Raquel, who is a colleague of mine, who she was involved with JC, who you'll see in this video, in making a video to demonstrate MI in a street outreach setting. And I love it because of the context, but also because it's Raquel bringing her full self forward in only the way that she can. And that's the way each of us should bring our full selves forward also. So we're going to listen to this, and then if there's time for a few comments, we'll do that. But otherwise, we'll leave it there. But I'll ask you to consider, what are her hopes? What are her methods? And what is the outcome in this situation? And I might add that this was a video that was produced, both parties having some lived experience, which they fed into the video, but it was totally unrehearsed and it wasn't written out or anything. So it's very spontaneous. But listen for the MI part. Listen for the piece where she taps into JC's knowledge and wisdom.
Hey JC, how you doing?
Hey girl, what's up? Good to see you out here.
It's good to see you too. Ain't seen you around here in a minute. What you been up to?
Just trying to make it. I mean, hustling, nickel and diamond. They tried to tell me that if I do anything more, I'm gonna probably end up in jail. So it's like, what can I do? It's always kind of like not quite making it.
Just not quite making it.
Yeah.
Well, what is making it? What is making it seem like? Is making it for me is different than making it for you. So what's making it?
Making it. I'd love to be able to take a girl home, take a girl out like you sometime. I'd love to be able to ride around in the car like the boys I see all the time, be hollering at the car. And, I'd like to have a place, instead of sleeping over at somebody's house all the time. My own place, my own stuff. Instead of bumming and all the time bumming. I'm tired of it.
Tired of bumming.
Yeah, girl.
So I'm hearing you ready to level up a little bit, JC. What do you think a girl like me or them girls you want to take out? What you think they're looking for, JC?
I can't handle it. I already tell you right now, high maintenance. I'm just hoping that I can eventually be able to live like a normal person. I'm tired of the hustle. It's every day, day in, day out, nickel and diamond. I just like to be able to relax, and then I'm sure, pimp like myself, man, I can pick up a girl here and there. That ain't no big deal. But
nah. Well, you got some good sales skills, JC. Why don't you apply those a little bit differently, brother?
What do you mean? Like how?
Make some money selling cars one day. There's a lot of things you can do to make money. I tend to used to be a hustler, but now I tend to hustle money a little differently. Not in the way I used to on the street.
Girl, I got some bad paper. I don't know if they'll let me in the damn car place. They probably think I'll be taking their cars. Look at me, girl. They won't let me up in there.
There's all kinds of sales jobs that you could apply that skill to, JC.
I would like, talk to me. I can't go in there making no $7.95 or whatever. What is the damn minimum wage nowadays anyway? It's the same as it was when I was a kid. Shit.
Nah, the minimum wage is up.
Minimum wage out here hustling, nickel and diamond.
Nickel and diamond. Yeah, but I hear you ready to trade all that hustle in for stability. I hear you're ready to trade all that in for what you said was a normal life. So what's that normal life? Is it getting up? Is it running your own schedule? What's that normal life look like for you, JC?
I had a normal job since I was a kid. I think I threw newspapers. That was the last time I had a job working for the man. I think it looks like I get up in the morning, I shower and shave. And there's some other S's in there somewhere, but I basically, you have responsibility. I want to be responsible for myself, but it'd be nice to be able to branch out a little bit, and maybe even one day have a family. I can't get no family out here. I can hardly take care of myself half the
That sounds like a beautiful dream, JC. I hear you want to have a family and some stability and maybe a little bit of rhythm to your life. You know, people call it obedience, but you and me don't like that word. Just a little rhythm, right? A little stability, a little rhythm to your life.
I like
Sounds
that.
like you're ready for that instead of that like reactive hustle all the time. It's
Hmm.
exhausting, it's tiring.
Yeah.
Are
Sound like
you open? Are you open to education? Are you would you be willing to try and learn something new?
you, are you gonna teach me?
I got people that will. If it ain't me, I'm not a teacher. It is not my, that's not my role, but I might have access to programs and things like that that you could at least start looking into. Curiosity.
Hmm.
Curious? I see it in you.
Yeah, yeah, I'm kind of curious. I mean, you ain't never talked to me like this. I just thought you was out here helping them homeless people. I'm not homeless. I'm not like them. I can at least speak in whole sentences.
Yeah, but you deal certain things and I deal hope and opportunity in a different way.
Mm, damn, that sounds nice. Hope and opportunity. Well, show me then. Show me what it is you're talking about. I'd be willing to look at it. I'm not making no promise, but you know, if you got something to show me, I'll take some time to look at it.
I got a good friend named Shayna. She runs an organization and she can help you look into that kind of thing. Look at your strengths and the things that make you you and see where you can apply the skills you already have to get the life that you want. Is it something you're interested in?
But she ain't gonna be like investigating me or nothing like that, is she?
Nah, she's one of us. You'll love her. I wouldn't bring you, I wouldn't drive you. Come on now.
You know what? I like you, so I think I'll go with you. Take me on over there, cause I ain't catching another bus over there. I don't know where it is. I ain't catching it.
Yeah, I got you. Come on. Let's go have some coffee. I'll give her a call. She'll meet us over at the shop.
You called me out, girl. Coffee? Let's go.
Let's go.
All right. Well, thank you all for listening in. I do want to address Mesha's concerns. Yes, I realize this can be construed as stereotypical, and he is misogynistic. He's also talks poorly of other homeless people. The idea here is what I love is how Raquel in this case actually takes all of that and kind of is able to redirect it without calling it out in the moment. But I think this is, certainly what can and does happen oftentimes. And so in that respect, I think she does a skillful job. But any other comments at all that anyone want to make? And then we truly will bow out, but I appreciate your hanging in there. More food for thought and a call in rather than call out. Yeah, thank you. Thank you. Okay, thanks, Nesha. Lyric, I'm going to turn it back to you.
Awesome. Okay, I know we're over time, so I'll go ahead and just end things out. I really appreciate everyone joining today. And if you continue to really enjoy these, please show up for our next ones. We have another one coming up on Thursday this week for the LGBTQ equal access training. So please feel free to join for that. But thank you so much, Ken, for doing this training today. I really got a lot of just thought in my own life about how I'm responding to certain things. So I have some reflection to do, but I really appreciate everyone's time. And thank you so much.
Take care all.